Hi, my name is Alberta Muhammad, and I've been a social worker for about 20 years. I'm currently a community clinical counselor with the Columbus Right Response Unit. And let me just say, I love my job. It's my passion, and I'm humbled that I can serve. When you have a mental health concern, it's one of the scariest times in your life. In the RRU, we've been able to stop people from harming themselves. We've connected folks with resources. And we also have freed up first responders because, to be honest, they can't be everything to everyone. Now, this doesn't mean that police and fire won't show up to your home. Sometimes it's necessary for the community to be safe. But we are doing important legwork for our police officers and our firefighters by de-escalating situations before they arrive. Recently, I took a call from a man whose mother was having delusions that someone broke into their home and was hiding. She also had a gun, and he was really afraid about that, and she wouldn't put it away. I was able to talk with him and her and eventually get her to give him the gun safely so that they could be safe. Also, I was able to give the family instructions on what to do when officers arrived so that everyone in the scene would be safe. And our mobile crisis unit was able to get her the help she needed. Another family that I worked with illustrates just how important it is to have the time that is needed to support and build connections with families. I took a call from a grandmother who was suicidal and was on the brink of ending her life. She felt frustrated and stuck. I was able to talk to her for around 90 minutes, validating her and helping her until first responders could get to her home. She was hospitalized and she got the immediate help she needed, and also sparing her grandchildren from getting off the bus and finding their loved one and caregiver tragically gone. It's situations like this and others that make me so appreciative to have as long as I need to provide help and support to the families that we talk to. This is the kind of support our families need. My goal is, by the time I hang up the phone, that I want every resident to be in the place where they can navigate their next mental health crisis, and a little bit better than they were before. So it's my pleasure to introduce Mayor Andrew J. Ginther.
Wow, that's what it's all about, Alberta and all of her colleagues. Let's give it up for them, for all their incredible work and service throughout our community. I'm the son of a social worker, so I know the power of what social workers, mental health professionals, caregivers can do for families, particularly families in crisis. And so I am grateful to Alberta and all her colleagues. Thank you all for joining us here this morning as we update you on the innovative strategies we've deployed to improve neighborhood safety across Columbus. Our approach is holistic and it is expansive. We're breaking down silos, exploring new ideas. We're delivering measurable results that directly benefit our residents and their well-being. One lesson we've taken to heart in recent years is that we can't simply police our way out of violence that we're seeing. Our response needs to be comprehensive, leveraging the power of prevention, intervention, and enforcement to ensure the greatest possible impact. This involves redirecting people from the criminal justice system and preventing them from entering it in the first place. Just a few moments, you'll hear more about these programs in greater detail, but know that our focus is just as much about improving quality of life as it is strengthening community safety. We want our city to reach its full potential. To get there, we must not only catch criminals and hold them accountable, but we also must enlist the appropriate resources and services to address a broader range of issues, like mental health and addiction. That's why we launched the Right Response Unit just over a year ago. We understand that law enforcement may not always be the best response for a particular situation. They don't always have the necessary training or experience to help certain individuals who are in the midst of extreme distress. And quite frankly, their time can be better spent doing what they're trained to do, fight violent crime in our neighborhoods. the Right Response Unit is showing great promise. We're reducing the demands on our officers' time and attention while getting the right response to people who are in urgent need of specialized attention or treatment. To break down just how much this program has already accomplished within its first year, I'm pleased to introduce our great partner and leader, Marion Stuckey from Columbus Public Health. Marion?
Good morning. I'm excited today to share the results of a groundbreaking first year of this innovative unit. The team of dispatchers and mental health professionals at the Right Response Unit have created and maintained a critical and highly skilled response to residents in crisis. Crisis callers are given the time and attention that they need to work through the issue at hand. This sometimes takes hours and extended amounts of time to provide de-escalation, community resources, and emotional support. The fact is, no matter how long it takes, the RRU team has proven it's all about the needs of that caller in that moment. The goals of RRU are to connect individuals in crisis with the right resource in the right amount of time, reduce the reliance on police and EMS for crisis response, and to continually improve and innovate the way public safety and Columbus Public Health respond to mental health calls for service. In its first year, the Right Response Unit triaged nearly 1,300 calls to 911. Approximately 1/3 of those calls for service did not require a police response whatsoever. That resulted in approximately 511 hours of time saved for police officers to respond to other public safety needs. Calls involving the RRU involve zero use of force. Only 12 calls for service involving RRU resulted in an arrest. We should note that these arrests were unrelated to the mental health crisis. Our trained social workers were able to provide immediate and free mental health services to callers in crisis. We connected more than 25% of those callers, that's a total of 343 in total, to local mental health providers. In hundreds of other cases, we were able to match the needs of the caller with our partners in alternative response. That includes the Mobile Crisis Response Unit, consisting of a crisis intervention trained officer and a clinician. They were dispatched 164 times. We made 185 referrals to the Division of Fire, the SPARK program, serving the needs of elderly in our community. And in nearly half of the cases where a police response was needed, we were able to work with the callers to verbally de-escalate before the officers arrived on the situation. These results are meaningful and promising. That's why we've already expanded our hours for the unit from 4 hours a day to 8 hours a day. And with the support and funding from the mayor and city council, we are hiring to expand our hours to 8:30 to midnight, Monday through Friday. We are actively seeking applicants who have a calling for crisis work, and I encourage any licensed mental health clinicians and professionals to apply who have an interest. You can join us in making a difference in the lives of the residents when they need us the most. Thank you, and I'll welcome Mayor Ginther back to the podium.
Great work, Marion, and truly incredible results. I look forward to seeing this unit grow and continue to provide vital support for some of our neighbors who are in crisis and facing great obstacles. In addition to Right Response, we've also been working over the past year to stand up a new program called Columbus Violence Reduction. Some of you may already know this as Group Violence Intervention, or GVI for short. We changed its name to reflect all the work that's gone into making this program a perfect fit for Columbus. Still based on best practices and case studies from other communities, but it's important to us that we make this as specific to our city as possible. Its premise is simple. By focusing on the extremely small number of individuals committing the overwhelming majority of the violence, we can achieve an outsized impact. Although work on this program has been underway for quite some time, its implementation is rather recent. In many ways, it is still brand new. To share more on the premise and the early progress, I'm pleased to turn it over to our Safety Director, Robert Clark.
Good morning, everyone, and thank you for being with us. Group Violence Intervention, or GVI, is evidence-based, nationally recognized model-based strategy based on several facts and in one particular that has proven to be true in multiple cities across the country. And it is proving to be true and effective here in Columbus. That is, a large percentage of violence is being driven by a very small segment of the population. An analysis of our local violent crime statistics found that at the most, 0.05% of the city's population is connected to at least 36% of the homicides. The same people responsible for that violence are also at the highest risk for being victimized themselves. The GVI strategy brings together a network of community stakeholders, law enforcement, community members, and social service providers to engage directly with those whose members are most likely to be shot or to shoot. Over the last several months, we have been working to build the network and infrastructure to bring success to this model. You've heard us say before that this is not a quick fix. It is a sustained community effort that takes a commitment of resources and time. Today, I'm pleased to update you on the status of this effort. First off, we have adapted the GVI framework to best suit the needs of the City of Columbus. Our model is now called Columbus Violence Reduction, or CVR. The primary focus of Columbus Violence Reduction is to reduce violence and improve the quality of life for members of our community. CVR operates with a three-pronged approach: support and outreach, community moral voice, and law enforcement. Our partners in this effort are violence intervention teams from Columbus Public Health, Columbus Recreation and Parks, Columbus Urban League, and nonprofit organization Community for New Directions. A key part of the CVR approach is what we call custom notifications. A custom notification is a personal intervention with those who have been identified as being involved in or at risk for violence. During these interventions, CVR members and law enforcement communicate their holistic anti-violence message and offer support to keep these individuals safe, alive, and free. These custom notifications are now underway, and I am pleased to report that of the 4 individuals who have recently received these custom notifications this summer have all accepted follow-up services and linkage with community partners. These resources range from victims of violence, hospital-based psychiatric counseling, community counseling, and school enrollment assistance. And as of today, there has been no known further acts of violence committed by the individuals who have received these custom notifications. But my friends, this is only the beginning. The implementation of this program has been methodical and measured. That has been by design. While we understand the urgency of this work, we also understand the importance of getting it right. We believe in this program and its potential to save lives. We look forward to expanding our outreach efforts and looking forward to community engagement and further partnerships. Thank you. It is now my pleasure to invite Director Carla Williams-Scott from the Department of Neighborhoods, who will share with you the amazing work of My Brother's Keeper program. Thank you.
Good morning. As Director Clark said, I'm Carla Williams-Scott, Director of the Department of Neighborhoods, and I would like to thank Mayor Ginther, Safety Director Robert Clark, Marion Stuckey with the CARE Coalition, and Alberta Mohammed for being here with us today. I would also like to thank all of my colleagues in city departments that have been working with our young people this summer to provide employment and enrichment opportunities. Just a few short months ago, in May, we shared with you our commitment to young people and funding for this summer. Youth employment. Today, I'm excited to share with you some of the early outcomes from that effort. I also want to point out that our summer contracts are currently wrapping up and preparing their final reports, which will be submitted later this month. However, we have some early reports to share with you today. This summer, the Department of Neighborhoods funded 16 programs serving over 3,100 young people ages 5 to 24. This was a $2.9 million investment in our young people. The summer of 2022 brought a renewed focus to summer youth employment and summer youth programming. We set a goal of expanding programming to help reduce violence. The goal of this effort was to provide work experience, career exploration, and educational and enrichment programs. Each of our funded programs had to meet one or more of our 4 key outcomes. These outcomes were to decrease the number of youth involved in violent incidents, to improve the youth work readiness skills, to encourage young people to continue their education and or find employment, and to provide academic enrichment. Young people from ICE Mentoring and Aaron Pink participated in programming focused on financial literacy. The program culminated with an all-day conference on a Saturday at Columbus State, where over 200 participants were able to hear from experts in the financial field and put their knowledge to work. They were also recognized for their achievements and participation in the summer program. For the second year, the Columbus Fashion Alliance hosted a program where our young people were able to learn about the business of fashion. By creating their own fashion brand, they created a website to market their products and invite the community to attend their 3-day pop-up shop, where they distributed over 1,900 items free of charge to members of the community. Summer program participants also learned about the importance of civic engagement and volunteering by helping to pack and distribute over 500 backpacks filled with school supplies. These backpacks were shared with children at the Columbus Boys Prep School, Yorktown Middle School, our City Rise Up C-Bus events, and the Columbus City Schools Resource Fair. Ladies and gentlemen, my colleagues have shared with you some of the efforts that we are working on to help reduce violence in our community. We know that homicides are lower now than they were this time last year, and we believe that engaging our young people in meaningful activities, providing them with opportunities, and letting them know that there are adults who genuinely care about them and their future has contributed to this reduction. Final reports from our funded agencies and organizations are due at the end of September, and we look forward to coming back and sharing those additional outcomes with you. Thank you very much, and I'd like to bring Mayor Ginther back up to the podium.
Thanks, Director. Thank you, directors, and Alberta and Marion again for joining us here today. We are relentless in our pursuit of a safer, more prosperous Columbus. Our comprehensive approach is working. Homicides are down and our closure rate is up. In fact, homicides are down 37% over this time last year. I'm optimistic about the direction we're heading, but I also know there is still much work to do. We will not accept the status quo. We will continue to implement reforms that put the right officers, the right resources in the right places at the right times in every neighborhood throughout our city. We will continue to activate leading-edge solutions that show exceptional promise and demonstrate a proven ability to reduce violent crime. We will not rest until we're the safest big city in America. We know we're not there yet. But I need every resident to pitch in and help out and to help us realize that vision. We'll be happy to stick around to take questions. Mel, would it be easier probably with the noise to do one-on-ones? I'll ask directors William Scott and Clark to stick around, and Marion and Alberta as well. But thank you all for joining us, and I'll be happy to take those questions one-on-one.